Excuse me. I just need to deal with someone.
Welcome to Stargatesing, a Stargate gazing podcast. I'm your host, Mary.
And I'm your other host, Kathy.
And each week we review an episode of Stargate alternating between SG-1 and Atlantis. Hello.
How are we doing?
Fine, how are you?
Doing okay.
Why are we laughing as we sign on? What's going on?
I just forgot. I was typing my name, which was going to be Cat Full, but it says Cat Foo instead, so...
It does. I thought that it meant Cat F-U, as in, like, you know.
Yeah.
And I was confused.
No. It was just an error.
That is silly.
Yes. Yeah.
What's new?
I have a kitty!
Yay!
Of my very own.
Kitty!
He's very cute. He follows me around. And he lays on me.
That's adorable. That is what kitties should do.
Yeah, except I keep kicking him already, so... But he'll get used to it or he'll learn.
Oh, poor kitty. Yeah, that sometimes happens when animals are underfoot. Coconut gets kicked frequently. Not on purpose, of course, but
No.
She just has the tendency to be very underfoot.
Yeah.
As in, like, I will turn around and she's right there and I will trip over her and then feel bad because in tripping over her, I just kicked her in the ribs.
Yeah. Oh. But they should learn.
Yes, you would think, but they don't.
No. And actually, until a few minutes ago, the cat was also trying to climb on my laptop, so that's fun. That would be a fun ruining of this podcast, so...
That would not be helpful.
No. I didn't banish him, but he seems to have banished himself, so that is good.
Excellent. Yes.
Yeah.
What's the kitty's name? Did you come up with a name yet?
I don't know yet. I mean, it might be Blue Steel. It just might.
Excellent.
Yeah.
I think it should. Obviously, because that was my suggestion.
Yeah. But also he looks like the Joker, too. I don't know.
He does.
But I don't want to call him Joker. I don't really
But
like
I was
that.
going to say, that's not, yeah. I mean, like you could, but.
He could, but.
Yeah.
And Harold's suggestion of, was it Perot, as in Poirot?
Yeah.
Which I enjoy, too, but Perot sounds too much like Ross Perot, and that's also just weird.
It's like a crazy ant in the basement.
I guess I could call him, was it Hercule?
Yeah. No, you're right. Yeah. Yes. You could.
Yeah.
Excellent.
He has a mustache, guys, so
He does have a mustache. It's very cute.
Yeah. Or he looks like Ben Stiller in Zoolander. One of those things. Yeah.
A bit.
Who doesn't have a mustache, but you'd have to see a picture to understand. Anyway.
Yes.
Yeah.
The blue steel look
Yes.
specifically.
How are you
Hence
doing?
my suggestion.
Yeah.
Good.
Good.
Not much. I was trying to think, do I have anything new to mention? Yeah, not really. Not really.
Yeah.
Grading, exams, nothing new.
Good times.
Nothing that I can think of. Yeah. That's about it.
Yeah.
I have no good segue for this episode, which was not a good episode, so I really can't think of anything for it. So let's just go ahead and get into it.
Sure, we can do that.
What is this episode we're talking about today?
This is Stargate Atlantis Season 3, Episode 6, The Real World. The story of 7 strangers living in a house. Just kidding. It's not that real world. Anyway.
Indeed. It's not even still on? I think
I
it actually
don't
might
know.
be.
Is
it
it?
lasted way longer than I thought that it should have or would have. I remember at one point being surprised that it was still a thing, and it was like way after I was the age that I was occasionally watching it.
That's so weird.
No idea.
Yeah.
It is weird.
People love their reality shows.
They do.
We start with Dr. Weir, who wakes up in a hospital room. In a bed. In the hospital room. She's in scrubs under the blankets. She gets up. She looks out the window of the door to a very empty corridor for a hospital, I feel like.
Yeah, it was weird.
Yeah. Things in this episode are weird. So,
Yes.
Yeah. So, setting the tone. She bangs on the door, shouts hello. Some people come around the corner of this empty hall and head to her room and let themselves in. The doctor introduces himself as Dr. Adam Fletcher, a.k.a. Cameron from Ferris Bueller, a.k.a. Alan
Indeed.
Rook.
I can never not see him as Cameron
I
in Ferris
know.
Bueller, though, no matter how many other things I've seen him in.
I know, and how much older he is every time you see him.
Doesn't matter.
Doesn't matter. He's still the guy wearing the hockey jersey.
He'll keep calling me. He'll keep calling me until I come over. He'll make me feel guilty.
But he's her doctor for this adventure. He tells her she is in the acute care ward of Willoughby State Hospital, which she recognizes as a psychiatric hospital. And she is surprised to hear she's on Earth, but they're like, yeah, of course you're on Earth. You never left Earth. And she's like, what? And that's credits.
After credits, we're back in the ward. It's specifically Fletcher's office, although we can see outside of it, and there's a whole bunch of other patients out there and some nurses and whatnot. Fletcher and Weir are talking about what happened to her. She was mediating a treaty about nuclear proliferation in Northern Africa at the UN, and she collapsed during her speech. So, of course, she was taken to a psych ward instead of an emergency room for reasons.
Of course.
Yeah.
That's what you do. You start with the psych ward and work from there.
Yeah, exactly. Dr. Weir says she doesn't remember coming back, meaning she doesn't remember coming back from Atlantis. And Fletcher doesn't have any idea what she's talking about, which did make me wonder why she wasn't trying harder to figure out what his clearance was before mentioning Atlantis. Because she didn't ask until much later in the conversation what his clearance actually is.
That's true.
Thinking back on the non-nuclear proliferation treaty, she says that was well over 2 years ago that she was working on that. But Fletcher says no, it was 3 days ago, and since then she's been severely depressed and near catatonic. But according to Dr. Weir, the last thing she remembers is being in her office on Atlantis and going over mission reports. So none of this can be real because she knows that was real. But Cameron assures her that it's real. So Dr. Weir has an idea. There's somebody very specific she would like to talk to.
The manager.
Yes.
Or the marshal.
Or the marshal.
That person, though, is actually Jack.
There's another Colonel O'Neill with only one L. He has no sense of humor at all.
Jack is here in his dress uniform. She is very happy to see him, and his expression is just like, I don't know what this lady's talking about the whole time they're talking. She thanks him for arriving and hopes he can sort out this mess. He's like, sure, in that polite tone of somebody you barely know. Anything I can do to help. He also, in this scene, looked rather giant. I think it was a camera thing
Giant?
to me. Big. Yeah,
Oh.
He seemed very big, large compared.
He's gained a bit of weight, but I didn't think he looked significantly bigger than or taller than before.
I just think it was the perspective with the background. It just felt like he looked a lot bigger to me, but not
notice.
Not in a weight gain way, just big. Larger than life.
Oh.
Anyway.
Didn't notice.
Yeah. It could be in my head. I don't really know. None of this is real either.
Nope.
We're not doing this.
We're not. Nope. We're not talking to you right now.
Nope. And you're not
a real podcast.
You're not listening to this.
Nope.
Instead, you're sitting in a house with 7 strangers.
You walk into this room at your own risk.
Why 7?
It's the real world tagline.
Oh. I forgot that it was 7. I rarely watched it.
Me too, but for some reason that part sticks in my head. It's
Stargate, huh?
Stargate, yes. This hospital room. When they go to sit down too, he very awkwardly, slowly plops into the seat there. I just thought everything about this was just kind of weird on the Jack side of things, but apparently that's just me.
I did think it was weird that he waited to be invited to sit. I was like, since when has Jack ever done that?
True.
Especially because it's not like she's somebody that outranks him.
Right?
Yeah.
So they sit down. She's very happy to see a friendly face. She tells him, and he's like, yep, I was going for friendly. And she tells him that the last thing she remembers, she was in Atlantis and everything was cool. And now she's in this strange hospital on Earth. And O'Neill is like, Atlantis? Everything's fine? Weir continues that she can't remember how she got back here. Was it through the Stargate? Was it through the Daedalus? But he has no clue what she's talking about. He says he's not qualified to be in this conversation. And she's like, obviously you're the most qualified because you ran Stargate Command. And he is like, sure I did. Whatever you say, lady. She finally catches on that he's not understanding what she's talking about. And she says, if you don't know what I'm talking about, then you're not really Jack O'Neill. And he is like, I sure am. And that's the only thing in this conversation I am sure about.
Maybe he's the Jack O'Neill with 1 L.
He could be.
So he's not the real Jack O'Neill with 2 L's.
Yeah.
Yeah.
How did this Jack O'Neill get convinced to come back to military service without the Stargate?
Maybe he never retired.
We don't get these answers in this strange reality.
Yeah. How would he come back?
I don't know.
Well, you got me. By all accounts, it doesn't make sense.
He doesn't know anything about Atlantis except that it was a mediocre Donovan song.
I don't know who that is.
It's a singer from like the 60s, I think, 60s, 70s.
Ah.
I recognize the name from my mom.
Fair.
Yeah. She insists that the Stargate is real and that it's inside Cheyenne Mountain. And he's like, dude, that's NORAD. And she's like, it's under NORAD. Duh. And he asks what the Stargate is. And she tells him it's a portal that allows intergalactic travel and that we've been doing this for 10 years. Then all of a sudden, his head freaks out. I don't know how to describe what happens to his head.
Yeah, it was kind
scrambles?
of Matrix.
Yeah.
It was kind of Matrix-y style scrambling.
Yeah.
It was freaky as hell if you think that this is like supposed to be the real world.
Yes. That is not a thing that ever happened on her Earth.
No.
And she is very alarmed at this.
Understandably. I don't think I would have reacted as calmly as she did if I were to see this.
No.
I mean, she was upset, but I would have been more upset.
Yes. Yeah, because he offers to get Dr. Cameron, and she's like, no, just leave. And that's it. So
Yep.
he gets up and leaves, wishes her well, and walks away. Weir heads toward another door, looks at it like she wants to go through it, but there's a guy, an orderly, blocking her way.
She makes it super obvious that she's about to try and escape,
She
too.
sure
Like, you,
does.
first of all, can't escape from these wards, but second of all, she makes it super obvious she's going to at least try.
Yes. I do think her hitting him was a surprise to him, but
Yeah.
generally trying to escape, no.
It reminded me a little bit of that scene from Monty Python and the Holy Grail when the son is being held in the tower and there's the two guards inside and he's looking at them as he tries to pretend to discreetly write a note and then looks over at the window and then backs over to the window and then continues to like look at the guards while he's firing an arrow out the window with his note. It just kind of reminded me of that.
Message for you, son.
Although in this case, the orderly reacted, whereas in Monty Python, the guards did not react.
It's true. He does stop her from going through the door.
Yes.
Cameron, who is waiting around the corner with a needle, rushes in and sedates her while she's being restrained by multiple orderlies.
Why did he just happen to have a needle with him?
I don't know.
Does he just carry one at all times just in case? Because that's weird.
I know. He seems like he's a guy in charge in this facility. Why is he just walking around with...
with a needle in his pocket,
Yeah.
right? With sedative that happens to be dosed just perfectly for Dr. Weir.
It's almost like
it's weird.
This is all a setup and this is all for her.
Yeah, weird.
Almost like that. Sometime later, Dr. Weir wakes up. She's sitting on her bed, just kind of hugging herself in the corner, and Dr. Cameron comes in. He has talked to a lot of people at the Pentagon who all say that there's no Stargate program. Of course they're going to say that if he has no clearance, so that was dumb. There's also no Atlantis in any other galaxy, no Department of Homeworld Security, blah, blah, blah. Everything is false. But again, they wouldn't tell him even if it was real.
She should have asked if they've seen Wormhole Extreme.
Right, yes. That is an excellent point, and she did not.
No.
Weir says, so you're telling me that I dreamt up the last 2 years of my life? And Fletcher's like, well, sometimes when you have significant trauma, your mind makes stuff up and just shuts down to escape from pain and makes some alternate life for you.
Your mind makes it real.
The treaty negotiations were clearly some trigger point because she'd been dealing with some extra trauma before that. It turns out that Simon died in a car accident that she was in with him. She was okay, he was not. They were coming home from dinner and another car ran a red light. So no, you never broke up. He's just dead. That's all.
Poor Simon Nareem.
Indeed.
Always dying.
I know, right? It never ends well for him. Dr. Weir does not believe any of this at all, but Dr. Cameron assures her that it's just her mind's way of dealing with the tragedy, to just try to erase it from her memory instead. And then Dr. Weir sees a person standing outside. You can't really see who the person is because it's frosted glass. It's just the outline of somebody just oddly standing right there at the door watching as they're talking. And she's not very pleased to see that. She is afraid of that person. Dr. Cameron doesn't see anybody, though, so he asks if she's all right. And that's the end of that scene.
I would be very messed up if I were her after watching Jack's head go all Matrix and then some creepy figure outside windows looking in at me.
Yes, agree.
I would be like, get me the hell out of here now.
Indeed.
Take me to a different hospital.
A better one.
Yes. Later, don't know if it's the same day or not, but some point later, Weir is outside with Dr. Cameron.
I find it very implausible that they would let somebody who had just tried to escape the ward that she was in all of a sudden go outside and wander around unsupervised with her mom.
It is very strange.
Spoiler alert, her mom's about to appear.
Yes, they meet her mom. She's happy to see her mom and tells her mom she doesn't know what's happening to her and she feels like she's asleep or in a dream. And mom's like, do I look like a dream? Do I feel like a dream?
You think that's air you're breathing now?
But Dr. Weir says, no, but the last 2 years of my life also didn't feel like a dream. So how could this all be a figment of my imagination? This is, as you said, they're wandering around the enormous grounds of this hospital completely alone.
Yeah, and there's a car driving by behind them, between them and the building. So they've even crossed a street to go into some park off of the grounds, in fact, at this point.
Yeah, so everything's fine. Yeah. They're not concerned about her.
She was just trying to escape not that long ago. But yeah, this is fine.
Yeah, her mom would scold her if she tried to run away. So
yes,
she's going to behave. Yeah. I guess.
Yeah, absolutely. Yeah. Of course.
Mom assures her the doctors are going to help her through this. And she really was very upset getting that phone call about their accident. And everyone's very upset about losing Simon. She doesn't know what she'd do if she lost Weir too. So they hug. And then Weir's mom pulls out her father's watch. She found the watch a few months ago and wants to give it to Weir. Maybe it'll make her feel better. And Weir is like, no, I had this watch with me the whole time I was on Atlantis. It's all very upsetting for Weir. And Mom's like, it'll be okay. You're safe. I'll make sure you're okay.
Indeed. Yes. Then it's nighttime. Dr. Weir is having trouble sleeping and wakes up to a weird dark silhouette of a person behind a curtain that's around her bed for some reason. She gets up to check things out, calls hello. The silhouette is still there, but when she goes around to the other side of the curtain, there is nobody there, and it's creepy. Yeah. And then we're in Dr. Cameron's office again. He's going to prescribe her some additional medications, mood stabilizers and antidepressants, stronger antipsychotic, and that should all help to reduce the acute symptoms that she's experiencing. Weir doesn't want to take those because she's afraid of wiping out the last 2 years of her life. But Dr. Fletcher Cameron talked with her mom. Apparently, when she was a kid, she had a brief phase where she dreamed of being an astronaut, and somehow that's relevant here.
Yes.
Because childhood fantasies can seem real?
Yeah.
Or something. It was a weird point to be trying to make.
It's a short leap from I have a telescope to I travel the stars through a ring.
Yeah, his point was that because she was fascinated with space and had a telescope when she was a kid, that's why she's imagining Stargate. It was quite a bit of a stretch.
Yes.
Yeah. Dr. Weir asks if she's only been here for a few days, how can she be imagining 3 years of her life? But Dr. Cameron says that time is relative in the dream state. And people can live out an entire lifetime.
Then we're in a common room in the hospital where patients are hanging out. She's at a computer looking up Simon's accident. A nurse comes by and gives her her medication. She hesitates for a moment before taking the cup from this lady. And then heads to the bathroom, which is yet another thing that's not at all suspicious if you have your medicine and then run right into the bathroom and flush it.
Right. First of all, you should not be flushing your meds to get rid of them.
Yes.
Second of all, I really hate the trope that psychiatric medications are bad and that they're just trying to numb you or make you not feel anything or whatever. It really annoys the crap out of me, and it makes an unfair stigma around psychiatric medications that can be life-changingly helpful for some people.
Yeah. And then after she touches that toilet handle, she wipes her mouth with the same hand.
Yeah, and that's
Come on,
gross.
Weir.
Yeah, that's very gross.
Gross.
I mean, I am a doctor, but I'm not that kind of doctor. I have a doctorate. It's not the same thing.
Next, we're in a group session. Dr. Cameron is there with Weir and several other patients. He's talking to a woman who's explaining that she didn't go out in the garden, but there were others out there, so she decided to wait. He asks if they saw her, and she says, yes, they were waiting for me. And she also spoke to them and told them my blood isn't theirs for the taking. Dr. Cameron congratulates her on her bravery. And Weir's like, what the fuck are you talking about? What others? And then Enid explains that the invaders from the moons of Saturn who are cold-blooded and need our warm blood. Dr. Fletcher doesn't think they're real, but I know they are. Then Fletcher asks Weir if she would like to speak next, but the way he said it was really obnoxious.
Yes, agree.
He's like, why don't you tell the group about your experiences in Atlantis? And she is like, no. He's like, how about yes? And she's like, no. And I was like, good for you, Weir.
The medical staff Doesn't arrive till Tuesday.
He's a really shitty doctor for multiple reasons, but particularly in this scene, if somebody is having hallucinations or delusions, you're never supposed to placate them and go along with it. So the fact that he was doing that is really shitty.
Yeah.
And then also, I've been in group therapy, and no therapist would ever just call on somebody to share their delusion with everybody else. They wouldn't tell everyone else the person's delusion. They would just ask, is there anything you'd like to share? You're quiet today. So this was, it just annoyed me.
Yeah.
Yeah. Shitty portrayals of therapy and mental health.
Yes.
All around.
Yes.
Yeah. Because he would be an awful doctor if he was actually doing these things.
Yes.
Sometime later, it's nighttime yet again.
Stupid nighttime.
Right? Nighttime's the worst. Dr. Weir is in bed, and there's lumps moving around under her bed, so that's creepy. She whips off the blanket, and there's nothing there. But then there's once again somebody just standing at the window staring in at her as she sleeps. And again, she can't see the person because the glass is frosted. She just sees the outline. She yells at them to go away, but they don't. She starts banging on the door at them and continues to yell at them. Sometime later, we see her back in the patient lounge taking her medication. And then she's wandering around the grounds with Dr. Cameron Fletcher. She asks if she's ever going to remember the accident. He doesn't know. He said that in many cases like this, the trauma just never returns. The brain just completely wipes it out. Dr. Weir thinks maybe that's a good thing, because there's enough pain even without remembering that. Cameron tells her she's doing great, and he is impressed. He asks how she's sleeping. She says she's sleeping better than she can ever remember. Is she, though? Because she's waking up and seeing people at her door or on the other side of curtains or seeing things under her blanket. So I don't know why. She seemed to mean it, which was weird. So Cameron says that he thinks that she's ready. Ready for what? We don't know yet.
I don't think you're ready for this yet.
Ready to go home, we learn immediately after this. Dr. Cameron drives her home.
Yeah, like he has nothing else to do.
He's her only patient.
Yeah, apparently. All the other patients in the psych ward belong to other people. That's why he had the needle dosed just for her, because maybe he's not allowed to work with other patients except for in that group setting because he sucks at his job.
It's a fancy hospital where it's a 1-to-1 doctor-patient ratio.
Yes.
Very efficient.
Yes, absolutely. Very doable.
Oh, yeah. There's a doctor for everyone.
Yeah, definitely isn't tragic staffing shortages in the medical industry.
No. But chauffeur Cameron brings her home. She says it's exactly how she remembers it, and a puppy comes out, and her mom.
Puppy.
So she's happy to see
It's a
her
cute
puppy
doggy.
and her mom.
Doggy was very happy to see her.
Yes. Mom welcomes her home. Later, Weir is sitting outside her house when O'Neill just walks up to her house.
Yeah, it's weird.
This time he's in his street clothes. Couldn't see how baggy his pants were because he was hiding behind a bush. But
I was trying to see, too. I was like, what are his pants like?
But I'm sure they were very huge.
Surely so.
He greets her and she calls him General, and he's like, nope, just Jack. Jack asks if she's all settled in, and she says she's getting there, and she is going to be teaching her poli-sci class at Georgetown in the fall. Jack wants to know if she's thought about coming back to the negotiating table. The treaty still needs her help. She asks, would the UN be okay with this? And he's like, they would love it. They miss you so much. You're amazing.
I thought that was a weird reaction.
Yeah. Jack's like, well, if you feel you're ready to go back. And she's like, actually, yeah, I am. So she's slipping back into her old life. No Atlantis to be thought of.
I thought that was a little weird, too.
Yes.
She felt that ready to just go back. Also, I was wondering when fall is, because if she was just released from a psychiatric ward, I would think that maybe her school would want her to take a little more time off. Is this a couple weeks before, or is this several months before? I wanted to know, but we don't get that answer.
We don't. That night, Weir takes her meds, climbs in bed. She's hanging out with her puppy, and she's like, it's good to be home. Oh, so nice.
Indeed.
Life is great.
But then we're in the Atlantis infirmary, and Dr. Weir is there. Shocking that it was not actually all a dream, right? Or a weird delusion. Dr. Weir is lying unconscious. She's got a cannula, oxygen cannula hooked up to her nose, and there's a clear plastic sheet all around her, so clearly she's in isolation. There's people in hazmat suits, and it's looking bad. Sheppard's there. He asks Beckett what's going on, and he says that it's not just in her brain anymore. They are spreading throughout her body, and they're losing her. They've got a scanner on a computer image, and we basically just see the outline of a person with a whole shit ton of red dots. Taylor and Ronan are there also, and Taylor asks if those are all nanites, and yes, all the red dots are nanites, so now they're through her entire body. Ronan asks how they got inside of her, and it was apparently Niam Cat, I guess when he stuck his hand in her head.
Well, they have a flashback, don't they?
Oh, that's right. I missed the flashback somehow. It was when Niam started choking her. I guess that was it. That makes less sense, though, than if he had done it when his hand was in her head.
I think that Oberoth was the only one who put his hand in her head.
Oh, was he? I don't remember.
He only held her hand. It's true. It was like 2 whole weeks ago.
It was. That's a long time to my brain.
I mean, to be fair, I also barely remember this episode. I literally just watched again. So, doing great.
Yeah. Anyway, after the flashback, Rodney is, of course, also there, and he is shocked that in one brief moment of contact, he was able to infect her with this many nanites and that they were able to start replicating so quickly, multiplying exponentially. Sheppard asks how much more time she has, but Beckett doesn't think that they're going to try to kill her. He thinks that they kind of just want to take her over, maybe, and use her body as raw materials to make more of themselves, maybe assimilate her and transform her into one of them. Yeah. They don't really know. They're just kind of guessing. And then maybe ultimately be their own independent entity. It's all very creepy.
Yes.
Ronan asks how they can stop them.
Okay, stop dots.
In the previous episode, they used an EMP. Sheppard recommends trying that again, but Beckett says they're too spread throughout her body and they're too integrated into her neurons at this point, so if they did try an EMP, it might just kill her. Turns out that in a petri dish, her white blood cells specifically were able to fight off the nanites just fine, like they were some kind of bacteria, but somehow in her body they're able to hide, and he has no idea how they're doing that, which I thought was kind of weird, because there are actually many, many different ways that bacteria, viruses, and fungi can evade our immune systems. So he acted like that was some novel thing that no infectious entity can do, which I thought was the strange part. Not that he doesn't know how it's doing it, but that he seemed shocked that it was able to evade her immune responses. So anyway, whatever medication she's on, he's increased the dose, and they're just trying to bide some time right now until they can figure out something more plausible.
Then we're back in Weir's head. Weir's arriving at the UN. I don't really know. Wherever she's headed, Jack is there to meet her, of course.
Yeah. My assumption was that it was, like the UN or something. Do you think the escalator stopped working for her? Do you think she then harped on it for several days that the escalator stopped working?
She is currently seeking vengeance against the escalator and everyone who's ever touched it. Sure. God. Dumbest timeline.
Everything's fine here.
It's great.
Everything's perfectly all right now. We're fine. We're all fine here now. Thank you. How are you?
Yeah. Escalators are the enemy.
Yeah, absolutely.
Boycott escalators, everyone.
I mean, that they did have to walk up the stairs, and
that's true.
Walking up the stairs is just so terrible.
Do you know the dumbest thing I thought was, I was looking at the video of that, the escalator next to them was also going up, and they could have just moved over to that one. But whatever.
I didn't even know that. Okay, that's hilarious.
Like, why? Why are we doing this? Anyway.
Why is this a thing?
Yeah.
Why is this a thing in the news?
Yeah. Escalator should never be in the news, I guess. No. Anyway, Stargate.
Boy, that escalated quickly.
Stargate.
Jack is excited to see her right on time. He asks if she's all set, and she says she thinks so. He asks if she got some sleep, because that is a thing that General O'Neill would be concerned about for a random person. I guess he knows her better now. I don't know, this weird reality.
Yeah.
She's like, sure, but she's been really tired lately. He's sort of her, at least through most of this, he's her emotional support, Jack. I don't know.
Yeah.
Till the end.
I want an emotional support, Jack.
Me too. But he's like, well, work yourself back into shape. He makes some sports reference that Dr. Weir doesn't get and doesn't even know which sport it's from, and neither did I until he was like, hockey. And I was like, cool.
He does love hockey.
Yeah. She tells Jack that she's feeling kind of numb, and he's like, I feel like that all the time. He asks if she talked to Dr. Cameron about it, and she says yes, and it's probably just her meds. They need some adjusting. O'Neill's like, yeah, a matter of balance, huh? And how about let's get to it? Remember, we're against proliferation of nuclear weapons. And she's like, yeah. And they go on their way. Are they on an escalator? I don't know.
I don't know. Then we're back in the Atlantis infirmary. Sheppard asks if Weir knows she's there, but Rodney says no, she can't possibly be. She's unconscious. However, Beckett says it's possible. So maybe try talking to her, tell her to keep fighting. It could be helpful for her. Rodney, being as skeptical as he is, kind of indignantly asks, well, how would that help exactly? But Beckett does say that in a coma, there is a sense of hearing, typically. So it is possible that people that are unconscious or in a coma could be hearing or registering on some level.
Is it the last thing to go and the first thing to return, like he said? The hearing?
I have no idea, and I actually did not look up that. I am skeptical of that, but I didn't even think to look it up. Yeah. Rodney says that this coma, though, was caused by a nanite. So he is very skeptical that what is true for a regular coma is going to be true for a nanite-induced coma. But Rodney says that there are indications that she's thinking or dreaming, or actually it's more like she's going about her every day, according to the EEG anyway. So it's not really even a dream. It is more realistic brain activity for her than a dream would be. So what are they doing to her? They've got immune-boosting drugs that they've been giving her that are not having really any effect, so they're still kind of at a loss for what to do. But then Beckett gets a look on his face, and Rodney says, I know that look. It's the look I get when I have a brilliant idea. Sheppard wants to know how he'd know that, but Rodney says it's because it happens in the mirror frequently. And that was weird. Beckett doesn't know that his idea is brilliant, but he does have an idea. We don't get to find out what that is yet, though. And then while Beckett and Rodney are off doing whatever it is they're going to do, Sheppard goes up to Dr. Weir. He's still standing outside the plastic, of course, but just talks to her a bit and tells her to hang in there and keep fighting. Then we're in Weir's brain again. She's in her bathroom taking her meds when she looks in the mirror and has no face. Yeah,
she is
that was very disturbing.
Genuinely disturbed. I was also disturbed. It was disturbing.
Tell me, Mr. Anderson, what good is a phone call if you're unable to speak?
But when she uncovers her face a moment later, after the shock, everything's fine. Then we're back with Sheppard, who's continuing to talk to Weir. He's like, I don't know what these nanos are doing to you, but keep on keeping on. Weir starts to pick up the pills she dropped everywhere, while Sheppard continues to talk to her. And then she throws them all in the toilet because she loves flushing drugs. It's
Don't
her
do that.
favorite thing.
They end up in reservoirs and waterways, and that's bad.
Sometimes she just goes to the store and buys some Advil and just dumps it down her toilet. Yeah. It's a weird thing she likes to do.
Yeah. But also, don't ever just stop taking any medication, even if you don't like the side effects, without talking to your doctor first, because you can actually die. Best case scenario, you might have some major rebound effects, and that can also be awful. So always talk to your doctor before you stop a medication.
Yeah.
Never just stop.
Yeah.
Also, most of them, especially psychiatric medications, need to be weaned off of slowly, and you're going to have major, major issues if you just stop taking them. Made me so annoyed.
Yeah. And then don't dump them down the toilet anyway.
And don't dump them down the toilet.
Yeah. Yeah. Ugh, guys.
Yeah.
Dr. Weir.
Sometime later, we are in Dr. Cameron's office again. He says that he's sure whatever her issues are just the result of the adjustment. So I was glad that she did at least talk to him about what is going on anyway.
Yeah.
Eventually, even though she didn't handle it properly. I mean, like, granted, I understand she couldn't see her face, and that is weird, but it was not the appropriate reaction. Anyway, maybe he dialed them back too far, so he actually wants to increase them rather than decreasing them. He says something about it being a question of balance, and Dr. Weir thinks that that's weird because that's exactly what Jack had said. But it's okay. Everything's going to be fine. They're going to get her back to normal. And then, of course, it is nighttime again, and Dr. Weir is back in her room with her puppy, so she's not staying at the hospital again. And she hears a voice calling to her. And there's a big shadow figure standing over her bed. She asks what the person wants, but the person does not actually answer. She goes into the living room after the person has kind of wandered out of her room, following whoever they were, clearly trying to find a bit more information. But then all of a sudden, when she opens a door, there's a Stargate there. And before she can go through the Stargate, some orderlies come out of nowhere and hold her down and give her another injection of some sort before she can pass through the puddle.
And she wakes up back in the hospital.
Yep.
Her emotional support Jack is there for her, asking her how she's doing. She wants to know why she's back there, and he says they're worried, and so am I. And I clearly been pushing you too hard on this treaty. And she's like, no, that's not it. And he says, you're going to be here until you get better.
Neat.
Yeah. Then we're back in Atlantis. Rodney and Beckett are telling Sheppard, Taylor, and Ronan Beckett's brilliant plan, which Rodney sort of steamrolls over Beckett doing, which is pretty funny. But, and by funny, I mean, don't do that to your colleagues, asshole.
Right.
So he announces they found a way to uncouple the nanite cells from Weir's cells. Beckett's like, we? Taylor wants to know how, and Rodney continues, we create a distraction. He has this cylinder in his hand that Beckett very gingerly takes from him and gently sets down, like, don't drop that. Beckett says it occurred to him why he wasn't having success. Rodney asks, what were the nanites originally designed to do? Ronan's like, fight the Wraith. So Rodney's like, yep, and that's what they're going to do now. Beckett says they're going to implant Wraith tissue into Weir's body, which is what is in the cylinder. Like a tumor, Rodney says. Beckett confirms a small tumor, and the nanite cells will be like, oh shit, we gotta fight the Wraith, and leave Weir's cells alone in order to do that. Beckett says they'll only have a few seconds. Rodney adds, but that's all we need, and then we can use the EM pulse. They're like, sure, okay, let's do that. And that's about it. That's the plan.
Seemed like a bit of a stretch.
A little bit.
If they're so intent on taking over her body, then that would seem to imply that they've already overwritten their original programming, so.
I guess, yeah. I don't know, but it's very weird.
Yeah, it was weird.
But sure.
Yeah. Back in the hospital, Weir is in the patient lounge. She's playing solitaire, and as she starts flipping cards, there's a bunch of Stargate glyphs. And she keeps flipping more and more cards, and it turns out that it's a whole gate address that ends with the Earth symbol. 8 cards, worth noting, so this would presumably be the address from the Pegasus galaxy, not within the galaxy.
But don't they have to dial the Earth symbol to dial out as the point of origin?
Oh.
I don't know.
Is it the point? Is the last one the point of origin?
I don't remember.
In any case, you got to go between galaxies.
Yes.
So either it's the address for Atlantis or the address from Atlantis to Earth, whatever.
Yeah.
In the Atlantis infirmary, everybody is getting ready to follow through with that plan. They've got the thing embedded in Weir's leg, and they're setting up the EM pulse emitter. Sheppard asks, don't we need to shut down all of the equipment in this room before they do that? But Rodney says, nope, it's directed specifically through this scanner. I actually looked up to see if that was really possible. And yes, over limited distances, apparently, the EM pulse can be directed in one direction. So if it was this short of a range, it should actually probably be okay.
All right.
Yeah.
I was wondering why Rodney was still putting that together while Beckett was injecting. Shouldn't they have made sure all the equipment was ready just in case?
You would, yeah, you would think.
But yeah, whatever.
Yeah. You would think.
But no. But it all will be fine.
Of course.
In the hospital, Weir is talking to Dr. Cameron and O'Neill about the symbols she keeps seeing. 8 of them. Dr. Cameron asks if they mean something to her, and she says it's the dialing sequence for the Stargate from Earth to Atlantis. And Jack asks, like, a phone number? She's like, yeah, you guys think I'm delusional, but I know something or someone is trying to communicate with me. And that Atlantis is real and she has to go back there. And Jack's like, oh, we're the fantasy? Not that I don't mind being fantasized about, but no, this is reality. Dr. Cameron, though, as you mentioned, continues to be a poor doctor and asks her how she would get back to Atlantis. And she says she would go to Stargate Command. And Jack's like, oh, just waltz into NORAD, huh? And Weir is like, I know, you told me it's not real, but she knows what she feels, that Atlantis is real, and she's going to get back there. So suck it, nerds.
Ancient Atlanta was more than just a Delta hub.
Back in the Atlantis infirmary, it seems to be working. They're looking at the image with all the red dots on it, and all of those red dots are, in fact, focusing on Dr. Weir's leg, right around the area of the wraith tissue injection that we saw before. Apparently they're moving very quickly, so they need to get that EM pulse ready, and then they send it in. And it seems to be working. The red dots stop appearing, and everything's great. Everybody rejoices. And then, oops, they realize that on the brain scan, there's actually still some there. So that's bad. They're replicating again in her brain. Yep.
No!
So they left the rest of her body, but still in her brain.
In the hospital, Weir is coming out of the bathroom, and Dr. Cameron is standing outside creepily and asks if she spit out her pills again. Obviously she has. She doesn't answer, though. And he says she disappoints him. She says the pills are not going to help her. And he says, not if you won't let them. She leaves him no other choice. Some orderlies grab her and they drag her to some room in the hospital where they strap her down.
This is not how electroshock therapy is done.
While people are screaming and against their will while they're strapped to a bed.
Yes. That is actually how they used to do it. Electroconvulsive therapy is not done this way anymore and hasn't been done this way for many decades.
Well, that's good.
It is still used, but people are anesthetized first and don't usually convulse either.
Well, then Dr. Cameron is extra mean because he's like, this will hurt.
Yeah, exactly. Yeah. It would not hurt if they're actually doing it the way that you are supposed to be doing it these days.
Cool. Good guy, this doctor.
Yeah, which is yet another thing that annoys me of just, again, the terrible portrayal of psychiatric treatment. And it is so not based in the reality of what psychiatric treatment actually is that it prevents a lot of people from seeking help when they need it, and it drives me insane. Yeah. No pun intended, but like I just hate that because so many people could be helped and they're afraid to get helped because of how badly it's portrayed.
Yeah.
Anyway, I guess I'll get off my soapbox again.
That's okay. Just keep it out.
I will.
It might need it again.
I will. I like my soapbox.
Yeah.
Back in the Atlantis infirmary, Taylor wants to know what they do now. Sheppard suggests using the pulse again, but they can't. Even though there's way fewer nanites, those nanites would have learned and would be immune to another EMP for reasons. They're going to put her over onto 100% oxygen. That will help somehow. And they're going to give her some norepinephrine too. Because, sure, why not? Yeah. I didn't really understand why he said they were going to switch her to 100% oxygen and give her norepinephrine, which is a vasoconstrictor. But he wanted to try to induce a hypoxic state, so that doesn't really make any sense. Putting her on 100% oxygen, whether you're giving her a vasoconstrictor or not, blood vessel constrictor, is not going to put her in a hypoxic state if you're giving her oxygen. He's trying to essentially render her brain dead, which, again, doesn't make any sense. I guess his thought is that giving her enough norepinephrine would cut off the blood flow to her brain, but that is not how that works.
Okay.
I don't know. It was weird. It didn't make any sense, really. But his hope was that rendering her brain dead would maybe get the replicators to leave her alone.
Yeah.
So that they couldn't try to take control of her brabrain.
I'm glad this didn't make sense to you, too, because I was like, I don't understand what this plan is.
No, it didn't. It made no sense. It was stupid. But that's what they're going to do. They're not going to completely cut off the blood flow from her brain, but they're going to just reduce it, maybe make the nanites think that she is dying, and then maybe that'll give her the chance to fight them off, which also made no sense, because if they were actually cutting off the blood flow to her brain, she would not have as good of a chance of fighting them off if they're expecting her to do that with her own will. So it really didn't make any sense whatsoever.
I mean, I'm pretty sure that most illnesses are fought with, as Taylor says, a battle of wills.
Yeah, right. Yeah, of course. Beckett did say that he was hoping that increasing oxygen levels, he was going to give her tissues more blood, but somehow not give her brain more blood. It really didn't make any sense. And Sheppard, of course, tells Dr. Weir that she's not alone. They're all there with her, and she's got to fight it.
Yep. Which it seems apparent now is blurry Sheppard.
Yep.
In her window in her hospital room.
Yep. At least in some of these.
Yeah. Urging her to fight it, which then she just rips off her restraints.
Yeah.
And escapes the room.
That's plausible.
It was a good job. Super-powered Weir. She sees Blurry Man at the end of the hall, so she chases him into an elevator, actually. Especially because now Fletcher was probably also hiding behind the corner again, because he is there in pursuit of her already. But she's able to close the elevator door before he can get to her. The elevator door opens and she's in the SGC. And Jack is there.
That was a quick trip.
Yeah, it's a good
From
elevator.
Yeah.
I want that elevator.
Right?
Yeah, saved loads of time.
Indeed.
Jack is there, of course. He tells her it's okay and she's safe. And to follow him. But before she does, actual Sheppard is at the other end of the hallway calling to her and telling her not to listen to emotional support O'Neill, because he is not her emotional support. He assures Weir he's not going to hurt her, but she is fully believing Sheppard. So she is like, the hell you aren't, and runs away and is pursued by both O'Neill and a bunch of SGC soldiers.
Yes. They fire on her even, but because it's all in her mind, of course, that doesn't actually do anything.
It's all fine.
Yeah.
I thought it wasn't real.
In the infirmary, Sheppard bursts through the hazmat barrier and holds on to Weir's arm, tells her to keep fighting. Weir makes it to the gate. Jack is there and says that he can't let her go. He tries to block her on her way up the ramp, but she says, "You're not General O'Neill." And then he morphs into Fletcher, Cameron Fletcher, for that matter. Dr. Weir is still intent on leaving. She's completely unfazed by this morphing of Jack into Cameron because she knows that this is all not real at this point. So when she continues to try to go on her way, it becomes Nyam Cat. And he says that they've already won, so just give up. There's no point. Absolutely no point. We've won. You can't get out of here. We've taken over. But she ignores him and literally walks right through him and into the event horizon, and he just kind of disapparates after that.
Yeah, he shatters into a bunch of nanites.
Right.
And it was a cool look, I thought.
It was. Yeah. And then Dr. Weir wakes up in the Atlantis infirmary, and of course, everybody is there looking delighted. Actually, Sheppard is not there because the people in hazmat suits did pull him away from her at some point, and he is now in isolation, but everyone else is there. She says, "Am I back in Atlantis?" And Beckett says, "You never left."
Yeah. Finally, Sheppard's released from isolation. He's nanite free too. And he goes to see Dr. Weir in the control room. It's apparently night again because he's like, still up, huh? It's night all the time here in this episode. And she's like, yeah, not willing to go to sleep just yet. They have a chat about the nanites. Weir says she only now realizes how insidious the replicator nanites really are. If such a small number of them could do that to her, ... what else could they do? Sheppard's like, let's take it for a win right now, because we're fine. Also, this all took place in 5 hours. She said it felt like a lifetime. Sheppard's happy to have her back in this real world. He thinks it's the real world. He could be infected too, he says. But Weir stops him. And that's kind of how they end the episode. He leaves. Yep. And she's just standing there thinking about this terrible thing that just happened to her. Yeah.
Did you like the episode?
Not really. I think we had already talked about in the last episode that urine and institution episodes aren't either of our favorites.
Right.
So I didn't like that, and a lot of it, you articulate it pretty well, that they just portray, like, mental health care as such a horrible thing in these episodes. Right. It's not great at all. No. I did think the spooky elements of, like, the things moving under her sheets and the ghastly figures in the windows were well done. I thought it made it creepy. The weird O'Neill head thing. Also, one of the times one of the figures was like in the window, I could swear it was making like raptor purring noises.
Oh, I missed that.
I might be wrong, but it felt like that to me. And then it was just, I don't know. It's not going to really be like a that they're in a fictional world. It's sort of like, what is this episode for? And I don't think it really did anything to like enlighten us on like Weir's character or anything like that. So it was kind of pointless. How about you?
Yeah. Yeah, I obviously ranted a bunch, and I ranted, I'm sure, about a lot of the same stuff when we were talking about the episode where Teal'c was the one that was in a hospital. I hate the whole gaslighting aspect. I hate the bad portrayal of medical care because, like I said, it does prevent people from actually seeking treatment who could really benefit from it. So I hate all of that. I found it to also be just really tedious and boring. And I think because, exactly like you said, it was very low stakes because we knew that she wasn't imagining things. So it just all felt pointless. It didn't feel like any real struggle. It just felt pointless because we all knew that in the end, it was going to turn out that Atlantis was real and she would be okay. So yeah, not a great episode.
Yeah. Other than maybe hating the replicators extra, I don't know what it does for the show. Like,
yeah. Right.
Yeah.
And it does almost feel like the replicators are overplayed because they were already a whole bad guy in SG-1 forever, and now they're pretty much gone from that show. We don't need to bring them over here. We can continue to just, fight the Wraith or maybe find something more interesting than just rehashing the same foe that we already saw them defeat in the other series.
Yeah. Yeah.
Yeah.
Boo.
Boo.
What are we going to talk about next in SG-1?
Next is Season 10, Episode 7, Counter-Strike. According to TVDB, the Jaffa take the fight to the Ori using a genocidal weapon, yikes, on their new worshippers and landing SG-1 in the middle of a war they can't control.
Oh dear.
Yeah. Yes. According to the booklet, when the Jaffa modify an ancient device that it is capable of defeating the Ori, Adria leads an attack on Dakara.
Oh, baby Vala's back. Yeah.
Adria?
Yeah.
I forget.
Vala's daughter. Yeah.
Yes.
Okay.
Neat.
Yes. I'm sure that will be very fun.
Yes. Not really.
No. They used all their fun in the last episode.
Yeah. Yeah. I don't... Yes, the last episode of Atlantis or the last episode? Oh, yeah, SG-1 was actually a fun episode. Yeah. I thought you meant this episode. I was like,
sorry. Yeah, no.
Fun either. Two unfun episodes.
Indeed.
Bad portrayals of psychiatric disorders and a genocide. Yay.
Everything's coming up Millhouse.
Just throw in an escalator and it's a total disaster.
Yep, absolutely. In order to have a true disaster, an escalator needs to be involved.
Yep.
Anything else?
I don't think so.
Thank you so much for listening to Stargazing with Kathy and Mary. Our fully listener-supported program couldn't be done without you. Show your support by telling everyone you know how awesome this show is. Find us at stargazing.space. Reach us by email, stargazing@gmail.com. Find us on social media at Blue Sky. Get some merch, tinyurl/stargazing. And finally, show your financial support at patreon.com/stargazing. Thank you for traveling through the gate with us. Catch you next time on Stargazing with Kathy and Mary.
I'm Mary.
I'm Kathy.
And you've been listening to Stargazing, the end.
The end. He's like, oh my God, can you hear him?
Yes, absolutely.
Oh my God. Be quiet.